Having the most accurate information possible helps doctors to properly diagnose and treat patients. Magnetic resonance imaging, commonly known as MRI, allows doctors to accurately examine the inside of the body without using harmful radiation or invasive surgery. An MRI scan works by using a strong magnetic field and radio waves to produce highly detailed images of the body. MRI can be used for examining all areas of the body, but is ideal for the brain and other organs, blood vessels, and joints. However, the strong magnetic field used by the scanner creates a potentially dangerous environment. Not only is MRI safety the responsibility of the MR staff, but all those who work within the facility, as the magnetic field is always present. The strength of the magnetic field remains constant even when the scanner is not in use. MRI science and facilities. The strength of the magnetic field is measured in a unit called Tesla. 1 Tesla, abbreviated capital T, is approximately 20,000 times stronger than the Earth's magnetic field. Lower strength magnetic fields are typically measured in a unit called Gauss. 1 Tesla is equal to 10,000 Gauss. MR scanners are typically 1.5 or 3 Tesla. In comparison, heavy industrial magnets are usually 1 Tesla. Due to the powerful magnetic field, it is recommended that access to MR facilities be restricted by establishing 4 conceptual zones around the scanner. These 4 zones are defined by their purpose and distance from the MR scanner. Since the magnetic field extends in 3 dimensions, some zones may extend into other areas or floors of the facility. Zone 1 consists of all areas freely accessible to the general public. This zone includes the entrance to the MR facility. The magnet poses no hazards in these areas. Patients are generally under the supervision of MR personnel once they enter Zone 2. Zone 2 usually includes the reception area and dressing room. Normally, these areas are also safe from all magnetic field hazards. Zone 3 often includes the MR control room and computer room. Access to Zone 3 is highly restricted. Only approved MR personnel and those who pass a screening are allowed into Zone 3. Zone 4 is the magnet room itself, also called the MR scanner room. Access into the MR scanner room should only be available by passing through Zone 3. Entrances to the magnet room must always be marked with appropriate warning signs. Together, the magnet room and control room are sometimes referred to as the MR suite. Within the MR suite is an invisible boundary defined by the magnetic field's 5 Gauss line. However, the 5 Gauss line can extend to areas outside the MR suite, including other floors, if the magnetic field is large enough. Magnetic fields above 5 Gauss, about 10 times Earth's magnetic field, are not strong enough to affect the body, but can disrupt or damage electronic equipment or implants. Magnetic fields cannot be seen or felt, so the 5 Gauss line is sometimes marked on floors or walls for safety. This is especially important when the 5 Gauss line extends beyond the MR scanner room. RF shielding. Since electronic signals can interfere with the scan, the walls of the MR scanner room are lined with radio frequency or RF shielding. The enclosure formed by the RF shielding, sometimes called a Faraday cage, prevents external radio waves from affecting the scan or the image it produces. Traditional RF shielding is normally copper foil or thin steel plating, combined with shielded windows and doors which surround the MR scanner room. Even a small hole in RF shielding may require replacing an entire wall section. Never hang pictures or modify the walls of the MR scanner room in any other way. Most contemporary MRI systems also have active magnetic shielding. Active shielding consists of secondary magnets built into the MR scanner, which help compress the magnetic field. For some MRI installations, additional passive magnetic shielding is needed. This is typically plate steel. built into walls, floors, or ceilings. Even with the protection of active and passive magnetic shielding, the magnetic field still poses serious hazards. MRI hazards. The magnetic field of the MRI scanner poses many hazards in or near the magnet room, the most dangerous of which is the missile effect. The missile effect occurs when magnetic forces pull magnetic items toward the center or bore of the MR scanner. A 1.5 Tesla MRI can pull items such as keys, paper clips, or scissors at 40 miles per hour. The more mass an item has, the stronger the attractive force on it will be. Heavier items, such as wheelchairs, can be pulled in just as quickly as smaller objects. The magnet can also twist and dislocate metallic components in electronics, power tools, and medical implants. Not all metallic objects are magnetic, but it is impossible to tell if a metal object is magnet safe by sight alone. Electronic devices brought into the MR suite can easily be damaged. This poses a potentially fatal danger to those with surgically implanted medical devices. Pacemakers, neurostimulators, insulin pumps, and intrathecal pumps can malfunction in the MR scanner room, possibly becoming a life-threatening emergency. Aneurysm clips can be pulled or twisted, tearing apart blood vessels. ID badges, credit cards, cell phones, and other items that store information can be erased by the magnet. MR scanners contain liquefied gases called cryogens that surround the magnet coil to keep the scanner cool and working properly. Cryogens have temperatures hundreds of degrees below freezing and pose cold burn and frostbite hazards. Over time, the cryogen slowly evaporates into odorless, colorless, and tasteless gas. The enclosed system captures and recondenses nearly all of the cryogen gas during normal operating conditions. Any uncaptured gas is safely vented out of the building. However, cryogen leaks can still occur during abnormal situations. Released cryogen expands very rapidly and can pressurize a room in seconds, possibly creating an asphyxiation hazard. The greatest risk of a cryogen leak is during an emergency shutdown of the magnet called a system quench. A system quench releases large amounts of cryogen to rapidly reduce the strength of the magnetic field during an emergency. Although serious, cryogen leaks are extremely rare and seldom cause incidents. The main causes of MR accidents are the improper use of MR equipment and not following safety procedures. The likelihood of an incident is greatly reduced when the facility staff remains focused on MRI safety. MRI safety procedures. Safety procedures are tailored for each facility, but certain general rules should apply. Never enter the controlled access areas within the MR suite without authorization from a technologist or when a patient is present. Everyone must be screened for hazardous items such as jewelry, loose change, and keys each time they enter the MR suite. Concealed metal, such as that found in steel-toed boots, pose the same safety hazards as other metallic items. Before potentially magnetic items are brought into the MR suite, they must be tested. Only items proven to be safe from magnetic field hazards are allowed inside. To help employees identify magnet-safe items, an MR classification system has been established. All items are classified as either MR safe, MR conditional, or MR unsafe. Specific icons are used to identify the categories of each item. These icons may be reproduced in black and white. However, the use of color is encouraged because of the added visibility. MR safe items have been tested and proven to pose no hazards in all MR environments. The MR safe icon consists of the letters MR in green in a white square with a green border, or the letters MR in white within a green square. MR conditional items are considered safe in most MR environments, but may have conditions or limitations to their use. These items must never be brought into the MR suite without prior approval from the MR staff. The MR conditional icon consist of the letters MR in black inside a yellow triangle with a black border. Most transports and medical devices will be designated as MR conditional, so safety within the MR suite depends on knowing what the specific conditions are for each object. MR unsafe items, such as electronic or magnetic items, present definite hazards in any MR environment. The MR unsafe icon consists of the letters MR in black on a white field inside a red circle with a diagonal red band. Any items not clearly marked should be considered MR unsafe. The MR staff test all items before they are brought into the suite and typically keep a database of safe and conditional items. General safety rules. Tools and housekeeping supplies used in the scanner room should be made entirely of magnet-safe material, such as brass, plastic, rubber, or carbon fiber. Never bring metallic or mechanical items or equipment into the scanner room without authorization. The magnet room door should remain closed unless entering or exiting the MR scanner room. All furniture in the controlled access areas of the MR suite must be completely free of metal, including screws or fasteners. If a burnt-out or broken light is noticed in the magnet room, alert a technologist. Ensure only a non-magnetic ladder is used inside the MR suite. Emergencies. Minor emergencies in the MR suite can turn into a more dangerous situation if proper procedures are not followed. If there is an emergency in the MR suite, 3 simple steps should be followed. Evacuate the MR scanner room, secure the room to prevent entry, and alert a senior technologist or manager. Never rush in an emergency. Always follow proper procedures. During medical emergencies, follow your facility's policies and procedures, especially instructions from qualified medical personnel. The standard procedure is to stabilize the patient, then remove them from the scanner room as soon as safely possible. If a fire occurs in the MR suite, evacuate the scanner room, secure the door, sound the alarm, and call 911 or your local fire department. Once the MR suite is evacuated, only properly trained personnel should attempt to contain the fire using only MR-tested and approved extinguishers. Never allow anyone who is untrained or unsupervised to enter the MR suite. Not all firefighters or other first responders are aware of the hazardous magnetic field. If the missile effect pulls an item into the scanner, a potential emergency situation may occur. Never attempt to remove an object from the magnet until it completely settles and an authorized person, such as a safety director, approves the removal. If the object cannot be removed safely, an MRI service company should be called. The service company may have to ramp down the MRI system, which slowly reduces the strength of the magnetic field. Ramping down the magnetic field interrupts patient care and can be costly. During life-threatening or critical injuries, it may be necessary to rapidly decrease the strength of the magnetic field by initiating a system quench. A system quench is a last resort because it can be dangerous, interrupts patient care, and is costly. Evacuate the MR suite before a planned quench or as soon as possible after an emergency quench begins. Only trained and qualified personnel may enter the MR suite after a quench is initiated. A weaker but potentially hazardous magnetic field and released cryogen may be present after a quench. Remember, the priorities in an emergency are to evacuate the MR suite, sound the alarm, secure the scanner room, and alert the proper personnel. An MRI scan is a safe form of imaging the body, but the powerful magnet it uses presents serious hazards if proper safety procedures are not followed. By being familiar with the safety guidelines and following instructions from MR personnel, the MR scanner will not present any unnecessary hazards.